will be joining us in the next few minutes. Good morning, good afternoon, colleagues. Welcome. Gives me enormous pleasure to be with you today and to welcome you to this first in the series of town halls that we at the Partnership for Maternal, Newborn and Child Health Secretariat are aiming to organize. We are a partnership of 1,500 members today, spread in over 120 plus countries. And as your new executive director, it is my immense pleasure to be with you today, but also to have this opportunity to open up the space for us to have a direct conversation with each other, not just for you to hear from us in terms of what's been happening at the Secretariat end and for us to provide you with updates, but also for us to hear from you. How are things going on? How are you looking at issues related to women, children, and adolescents' health in your country constituency context? We have a lot going on within the PMNCH space, and there is a lot to cover with us today. I have immense pleasure also to welcoming the chairs and the co-chairs of different constituencies who have taken time out to join us, and different colleagues who will be speaking to you momentarily. This is a dialogue, and this is a dialogue that we very much hope you would openly participate in. Please do use the chat function if you have any questions, clarifications as we go along, or by all means use the hand feature if you want to make an intervention at any point. We do have in the agenda, which my colleagues will paste in the chat right now, slots that we have identified for us to have a moderated discussion about things that you will hear and about issues that you may want to highlight in terms of how we are trying to navigate the different spaces that we are working within. With that in mind, and without much further ado, I would share my screen, and I very much hope the technology bears with us. If somebody can give me a thumbs up that they can see my screen now, you can. Thank you so much.
Thank you.
Thank you. Colleagues, there are a lot of new members. So one of the things that we thought that we will try and do also in this town hall conversation is to give you a little bit of a quick introduction of the partnership or ways of working. And then very swiftly, I will turn to my two esteemed guests, Kate Gilmore and Priya Nanda, who are leading on different bits of evaluations of the partnership's work with us, and they will share with you some key highlights of the processes that are undergoing and also tell you how you can input into those processes. The agenda for our conversation for the next 2 hours is in front of you. As you would have seen from the invites that we shared, that we will have the same conversation in the afternoon as well, so as to cover the different time zones that we will be covering and where our different partners are situated within. If there is anything on the agenda that does not meet your expectations or any amendments or additional items you would want to suggest, please feel free to add that in the chat, and we will make sure we find time today to cover that with you. Very briefly, to give you a very quick snapshot of the partnership's value proposition and also what are the current activities in our work plan that we are doing. As you know, we are the world's largest multi-stakeholder partnership working on women, children, and adolescents' health. The breadth of the partnership speaks for itself. We are divided in the 10 constituencies that are highlighted in front of you. We are the only partnership in the world today that covers all constituencies ranging from governments to United Nations agencies to healthcare professional organizations, donors and foundations, but also including private sector, young people, and civil society organizations. The convening power, therefore, that the partnership has in terms of advocating and ensuring accountability for women, children, and adolescents' health is rather unparalleled. The question and the challenge to all of us in these contested times is how are we leveraging that potential of this partnership? How are we advocating for women, children, and adolescents' health and holding the duty bearers to their commitments to ensure that these issues are dealt with to the fullest extent? And what are we doing in different spaces accordingly? With that in mind, our vision has been defined as a world in which every woman, every child, every adolescent is able to realize their right to health and well-being, leaving no one behind. Our work, as you know, is cascaded into three thematic themes, which covers maternal, newborn, and child health and preventing stillbirths, sexual and reproductive health and rights, and adolescent health and well-being. And one of the key issues for which the partnership was formed almost 20 years ago was to achieve reduction of preventable mortality for mothers and the newborns. However, as all of you know, from 2016 onwards, we are looking as an increasing stagnation of progress being made in this regard, but also reversal of gains that were achieved during the MDGs era. So the question that begets to us all as this partnership that spans all the 6 regions of the world, what can we do to accelerate action? The challenges confronting the anti-SRHR, anti-rights aspects is very profound and is inhibiting our ability to deliver on this acceleration of reduction for maternal, newborn, and child mortality, but also to realize the fundamental rights of women and men and individuals all around. The issues related to adolescent health and well-being are equally profound. We are looking at increasingly challenges that are facing adolescent health and well-being, which has direct impacts in terms of their overall growth and advancements of societies. The theory of change and the results framework for the partnership has been defined through an intertwined series of inputs, outputs, and outcomes that we aim to achieve. As a partnership, we work through an interplay of knowledge synthesis, partner engagement, and advocacy and accountability to achieve meaningful gains and investments for women, children, and adolescents around the world. There is a lot to be said. These slides will be shared with you subsequently. I will not go into much detail of them right now, but if you do have questions, please do feel free to come in at any point. Some key highlights at this stage, and from especially emerging from the board meeting in early July. One of the key things that came out of the board meeting was how we can strengthen the governance structure of the partnership, making it more agile. Identifying also lessons learned from the 2025 and 2021 to 2025 time period, and identifying what have been our key learnings and how we can improve on them as we look into the next strategic time period, and also developing an overarching framework through which we will be working on these issues. So with that in mind, we have 3 evaluation review processes underway right now. The first is with regards to the governance review, and you will hear from Kate Gilmore in a moment. The second is the external evaluation of a present strategic plan, which is being led by Priya Nanda and the team, and Priya will be speaking to that momentarily. And then the third is the development of the 2026-2030 strategic framework consultation with you all, with the constituencies, to hear from you what you want your partnership to focus on within that time period as we achieve the final mile for the achievement of the Sustainable Development Goals. I will pause there for the moment and first hand it over to you, Kate, to give a brief snapshot of the governance review that you are undertaking, and then turn to you, Priya, to cover the other review as well. Kate, over to you.
Thank you so much, Rajat, and hello, everybody. Warmest of greetings. Thank you for the opportunity to speak with you about the Governance Review 2024. This review has been commissioned by the board with the intention that it be a rapid assessment of the current governance arrangements, and that it provide recommendations designed to simplify the current governance system significantly, that those simplifications and streamlining should enable better collaboration, stronger collaboration for strategic purpose, and in particular empower the executive director and the secretariat to be more agile and responsive. The streamlined processes that the board want to hear recommendations for should be inclusive, should be enabling of PMNCH's effectiveness, its impact, and should address the challenges around its sustainability, including its financial sustainability. We have I think there's a little bit of feedback. There we go. So the approach in this particular review is threefold. One, to build on the findings and outcomes and recommendations of previous considerations or assessments of the governance system. And there have been 2 or 3 of those within the last few years. So we want to build on those, consolidate the strengths, address any issues that remain. It relies heavily on the perspectives of those inside the governance system who've experienced it. So there's been surveys and interviews and focus groups to establish what is the broad consensus of key stakeholders in PMNCH about the governance system. And we'll also take a look at best governance practices, try to assist PMNCH be reassured that it's being governed to top standard. The review will report to the December meeting of the board, where your constituency representatives will have an important part to play. We would love to hear from you any perspectives or experiences, any of your assessments about the governance of PMNCH, and in particular, any hopes or expectations for that in the future. A great way to do that is via your constituency leads and the representatives in particular on the board, to ensure that they know what your views are. You can also get directly in touch with the review via the Secretariat, and I'll also leave my email address in the chat. Hopefully, the review will enable PMNCH to drive forward the strategy that is being designed now on the basis of the far more important and substantive evaluations underway. Thank you very much, Rajat.
Thank you. Thank you very much, Kate. And just for colleagues to know, we have a moment after this for you to have any questions, clarifications, and Kate and Priya will be staying with us online for the Q&A segment, if possible, as well. Priya, over to you.
Thanks, Rajat. Good morning. Good afternoon to everybody. Very excited to be here and get this time on the town hall meeting to talk to you about the evaluation. Rajat's already introduced the 3 work streams for these assessments, and Kate's talked about the governance review. I'm going to talk about both the evaluation and the strategic priorities work that are both being led by Global Health Visions. There are 2 different teams within Global Health Visions that are doing this work. So Global Health Visions has been requested by PMNCH to conduct its evaluation through the current strategy period 2021 to 2025. And that evaluation is co-led by me, Priya Nanda, and my colleague Jessie Clyde. A separate team which also conducted the SRHR Global Advocacy Landscape Assessment earlier this year, has been contracted to conduct a strategic prioritization process for all the PMNCH focus areas as an input into the next 5-year strategic plan. And that's led by Ann Stars and Caitlin from GHV. The work that I'm leading with Jessie, which is the evaluation, will also feed into the strategic priorities process, which is why these work streams, I think, are designed as 2 contemporaneous processes. So both the teams of GHV are conducting a series of interviews and focus group discussions with key stakeholders. Some of these interviews and FGDs may be with the same individuals for both the evaluation and the strategic prioritization work streams. So while they're separate interviews, we are doing them in close coordination just to optimize time. But the 2 work streams are working independently though closely connected for work plans and logistic purposes. I just want to emphasize that the evaluation is separate and independent in all the analysis and the way the interviews are conducted, although the insights will feed into the work that Anne is leading. Interviewees for both of these include board, executive committee leadership, working group and work stream leads, constituency representatives, and current PMNCH donors. Most of the interviews are complete, and some of the constituency focus group discussions have been scheduled to be conducted next week. So our plan is to share the preliminary findings with the executive committee in mid-November in preparation for the December board meeting, which Kate also mentioned. The evaluation covers areas that are really focus areas of the strategy. So it's really derived closely from that, such as the key achievement and challenges for the advocacy work in its three thematic areas, how well it works in the three functional areas of PMNCH, what is its unique value globally. Rajat mentioned that in the beginning in the presentation, but we also want to hear your reflections on that. The work in really bringing local to global connects and vice versa, because the partnership is so diverse. Its work on advocacy and moving to accountability, and its overall approach in communication and measurement. So these are kind of the key domains for evaluation. In the evaluation, I think one of the most important things I want to also emphasize is the fact that we are really focusing on having a anonymity and confidentiality in all the information that is shared with us. So in the consent we seek in all the interviews, we assure that none of the voices are directly attributable in the way we present the analysis. Now, the strategic prioritization interviews cover questions on global context of PMNCH's work from 2025 to 2030. So it's really looking forward. PMNCH's thematic focus area, its unique value in global advocacy for MNCH and SRHR and adolescent well-being, as well as the key advocacy outcomes in these areas and the balance between global and the national focus. I think what I want to kind of end with is that while we've been doing all the interviews and desk review and focus group discussions for our evaluation, what we have envisioned and we have developed within our approach for the evaluation is a short anonymous partner survey. This is so that we can really reach out to the diverse network and really capture your insights to the extent possible within the purview of and scope of the evaluation. So that short anonymous partner survey has been developed, and it will be shared with you soon after today's meeting. So I want to emphasize, for me, this is a really important opportunity to connect with you all, because we want to hear from you directly. And one of the mechanisms to do that is through the survey that we'll be sharing soon. Thanks, Rajat.
Thank you. Thank you very much, Dina. And the link to the survey is actually in the chat that has been posted by Dina, and we will be sharing it via email with the meeting participants as well, so that you have. And Kate, you would be providing your email as well for people to reach out to you for the governance review side of things. Colleagues, before we dive into the updates from the constituency chairs, I just wanted to pause here for a moment. You have heard some details, some complex information about evaluation and reviews. In case you had any questions or clarifications right now, otherwise we will come to an open discussion and a cross-constituency dialogue in a moment after we have heard from constituency chairs as well. But I just wanted to take a moment in case anybody has any quick clarifications that they wanted to ask Kate, Priya, or myself at this point. I see no hands, in which case what I will do is go over to our esteemed chairs and co-chairs from the different constituencies who are present with us today. And my sincere thanks also to Priya, Naveen, and several colleagues who are joining during the holiday period from India. And amidst all the celebration and family time, happy Diwali to those of you who celebrate, and really appreciate your commitment to joining us in the middle of all the festivities as well. Naveen, with that, can I start with you, please, for the HCPA updates that you would want to share? Over to you.
Thank you so much, Rajat. I am presenting this on behalf of our chair of our constituency, N. Kihara, who has a bad throat. So and she will be available to answer if you have any question. So our healthcare professional constituency is very unique, and this is the only place which I can say in the across all our our other any other area, child health or women's health or other, it is the only place where we work all together. So thanks PMNCH for bringing us together across discipline, across Asian countries, and we represent millions of health professionals committed to do their best. And as if I say for IPA, we have from 175 members from 154 countries, and we represent 1 million pediatricians. And similarly for FIGO and ICM and other constituency. So thanks to our dynamic chair and who immediately started working before even board meeting and decided the priority. Our first key priority, as she identifies, healthcare worker to work as a professional team, and it should be fit for the purpose. And PMNCH provides a great opportunity for us to discuss together how we can deliver as a team and how we represent each other. And with PMNCH now, we are already working with each other, collaborating on our scientific programs, our say projects and our conferences. So thanks PMNCH, and thanks for this and for bringing us together. Second priority, she identified that we can only deliver if we work closely and are supported by other partner, government, private sector, CSO, youth, who, if they listen to us and help us for advocate for our needs, so that we can do best for the women, children, and adolescents. And there are many examples where it works, but much more needs to be done. We have seen during adolescent, say, global forum, how we worked at country level together and with other partner, and that has helped us a lot. In this spirit, we are happy to contribute and lead to cross constituency activity. One promising opportunity is to collaborate with adolescent and youth constituency, as we see more and more the need to upgrade us. Definitely, they can help us a lot in upgrading on all these other social media and other things which they are wonderful. We are excited with the Global Leadership Network to see our agenda being elevated at the highest political level, and thanks to PMNCH for that. A few highlights finally from our work this year. We had 3 extended leadership meetings of all SCPA representative across PMNCH governance structure. We issued a survey to SCPA leadership organization to identify gaps and synergy within our work, with a key aim to see how healthcare professionals can deliver as a team. We are coordinating on key events, as I mentioned, between midwives, nurses, OBG, pediatrician all together. We are actively engaged in diverse PMNCH products and activities, represented our constituency by 3 of us, Anne, me, and Sandra, at board meeting, calling for a business unusual. This is the term which Anne used at the board meeting. It should be business unusual, and that only we can succeed. Some examples are MNCH resolution implementation, including in CAP countries, where we had a statement of support for that. We are working with WHO, ICM, FIGO on addressing postpartum hemorrhage. Kenya recently held a session. PMNCH policy dialogues, health workforce. It will in November 25, we have a policy dialogue. We are starting a series of policy dialogue. First will be on health workforce, and followed by convening series into 25 to discuss and agree on how we as a health workforce we do deliver despite all challenges and obstacles. Young HCPA survey, this is very interesting, which is done by our young HCPA constituency, and there are very good findings what the young healthcare professional want and what are their problems. We are also helping in PMNCH advocacy brief and building on the last year's success with Global Forum for Adolescent. We are engaged with follow-up on action agenda for adolescent. Another critical agenda is to see advancing its respectful care. We issued our commitment following the WHO resolution on respectful care for the mother, newborn, and child health. So I stop here and will be available to answer any question. As Rajat said, this is the Deepavali time, family and festival time, and but still it's our commitment for the children. And I will pray to say Goddess Lakshmi to fulfill all our financial requirement. And this is Festival of Light. And I will definitely pray that through PMNCH, we can light everyone's home across the world. Thank you so much, Anne, for this opportunity. And thanks, Rajat.
Thank you very much, Naveen, and for your very kind remarks. But as I said in my introductory remarks, the power of the partnership is through its partners, and this is a unique opportunity, colleagues, for us to hear from the different constituencies, but also try and reflect how we can generate some cross-constituency conversations so that we can deliver for the women, children, and adolescents in countries that we work in and on the ground. With that, first set of reflections from the HCPA constituency delivered by Naveen and on behalf of other colleagues as well. May I turn to you next, Marlene? I think you are online for the update from the ART constituency, and then moving to you next, Hafsa. Marlene, over to you.
Thank you, Rajat. Am I audible?
Yes, you are.
Okay, good morning and greetings from Kenya. I'm bringing you some of the reflections for the ART on behalf of Mike Mbizwo, who will try to join later, but is not sure that he can make it. So we as chairs, we are happy to see that there's more structure brought to the cross-constituency collaboration, as this is something what Mike and me, what ART have been asking for a long time, and ART is very happy to contribute to this and the activities and the products in the future. We really would appreciate clarity on what PMNCH is expecting from the constituencies and how they should be best and most efficiently participating. We see ourselves close to the knowledge evidence group, and in the past, both of us have been part of meetings where we had more or less the same agenda in the morning with knowledge evidence and in the afternoon with ART constituency, so we could have a more efficient collaboration, I think. We see ourselves as a resource to the Secretariat, and we would like to ensure that it is used effectively. So just a few things. In 2024, ART has contributed to the development of PMNCH Advocacy Brief Series, including prioritizing women, children, adolescent health and climate crisis, and a second one, investing in the health and well-being of women, children, adolescents briefs. WCH intersectorial financing papers, including opportunities and challenges for financing women's, children, adolescent health in the context of climate change, was also contributed, and the AWB report, Adolescents in a Changing World, the case of urgent investment. So these are some of our contributions. We also provided feedback to the PMNCH work plan and deliverables and contributed to the development of all 3 PMNCH discussion notes. We provided a review on WCH economics and financing evaluations, and we were represented by Mike Mbizwo and Gamal Serur and myself at the July 24 board meeting. ART has about 204 member organizations across 53 countries, some of them active, others more on paper and more difficult to engage. We would be grateful to understand from other constituencies how they are working to engage such a broad range of members. And personal, I've tried to engage other universities here in East Africa, and very often we get the question, yeah, it's great, but what is in it for us? I don't mean financially, but what actually if we contribute time and energy. So, I mean, there could be, I think we have to work a bit more to be clearer to our partners how they leverage themselves and their work through PNMCH. So in the current format, till now, ART contributes and plans to contribute to PNMCH activities in two main ways. Number one, we are available for response. We are responsive ad hoc. One, products, interventions, activities requested by organizations on sexual, reproductive, maternal, newborn, CH, etc., or long acronym. Example, the Zambian Parliament. We have updated them on MCH issues, and ART prepared a brief that was presented at the Parliament within a few days, within a few turnover in days only. Number two, so responsive ad hoc. Number two is really the planned PNMCH activities. We will contribute to, as we did in the past, to products including advocacy briefs, human resources for health, Q4 in 2024, but also we are quite active in the new IWENE, bringing together the ENAP and the EPMM. And I'm a very active member in Kenya with the Ministry of Health. Also, child survival, Q1 of 25 is an important topic. Number two, MNCH resolutions. We are really interested in devising a synthesis of the WHA resolution into a policy brief for parliamentarians, because we need to reactivate our efforts in maternal morbidity and perinatal morbidity and mortality, as we all know, and as was highlighted again through the WHA resolution. Then also policy dialogues and services for interventions, the health workers in collaboration with our colleagues, services and interventions. Now, to end a few, so these are our three activities that we want to work. And of course, as ART, we want to work together with HRP, that is actually providing a lot of evidence. So we want to make sure how do we work better in, the evidence that is already there, that we don't repeat what our colleagues of WHO and others have done, and how do we contribute to the advocacy around it. Now, some potential questions before I end is, how are the constituencies working to engage a broad range of members rather than just the usual characters? Number two, where is there space for individual and collaborative constituencies to work more significantly on products and events related to our agenda? Often ART is asked to comment, to suggest some edits on existing products, but it would be good to understand where the constituency, our constituency, can contribute in a more substantial way. And number three, how can ART members effectively identify and leverage opportunities for PNMCH engagement across the evidence to policy cycle, including stages of knowledge generation, evidence synthesis, knowledge translation, contextualization, and data utilization to enhance policy and implementation efforts. Now, a very last word. I'm so happy, maybe that is later on the agenda, with the CAP efforts, because one of my complaints was always we meet PMNCH members from a country, in my case, Kenya, in Geneva, in Washington, in London, wherever we are, but we don't work together. And for me, the country constituency is one of the most important ones to have impact. So working together now in the new structure with the CAPs is really, I can testify from Kenya, is really moving our visibility in a country forward. Before, only the PMNCH members, but if you move outside our own club, not many people in a country know what PMNCH is. And I think that is being now taken up by the CA, by the CAP efforts. So thank you for that. Over to you, Raji.
Thank you. Thank you so much, Marlene. Very, very helpful, both in terms of not only the enormous contribution that ART is already making, but also for your reflections on how we can strengthen and streamline some of these processes, which is very valuable, not only to me as the new executive director, about 5 months in the job now, but I think for both Kate and Priya as well, who are leading on the governance review and the evaluation. And one of the things that we are from the Secretariat, what we are trying to do more of is how we can bring more space for these cross-constituency conversations to happen. Because as you very rightly pointed out, this is where we have a lot of potential and uniqueness from the partnerships perspective to drive change. So I hope as we move into the discussion in a few minutes, once we have heard from a few other updates from AY and from NGO constituency and private sector, that we are able to share some reflections. And I'll also invite Kate and Priya at that stage in case they have any reflections to share as well. Hafsa, can I come to you next for your updates representing the AY constituency? Over to you, Hafsa.
Right. Thank you very much, Rajat. Hello, everyone. It's a pleasure to be here and happy to share a few updates of what the AYC has been up to and some of our future plans. So as you know, a new AYC leadership was selected and the team has been engaging in quite a few activities and will plan to contribute to activities that is part of the work plan. So the team currently is supporting the transition of the 1.8 young billion People for Change campaign to What Young People Want campaign, and the leaders co-authored a blog recently and was published to announce this transition, and they are quite looking forward to working on future activities as part of this. And I think as part of that, along with the UNGA events, there were side events that was held and the call to action was launched at the closing session of the Youth Power Summit. And because that sort of gave young people a chance to share their ideas. And what our favorite part was the actionable steps and solutions in terms of adolescent well-being, and sort of highlighted how young people need to be there for policies and decision making that impacts them. So we will share the call to action in the chat as well after my sharing of thoughts. The call to action actually focuses on increased evidence-based investments to all areas of adolescent well-being and how commitments must translate to national plans. Apart from that, the AYC also engaged recently at the IPU Assembly, and we highlighted the importance for meaningful and adolescent youth engagement through impactful video interventions. In terms of the future activities, the AYC is working on how to engage members across more activities through the PMNCH work plan. And we are looking at, for example, identifying AYC members to revitalize their engagement in countries where the CAP projects are going, and working with our AY grantee partners to strengthen their collaboration. And we are also looking at connecting with other under 30 young leaders in the other constituencies, because we are very keen on cross-constituency collaboration, because we want to make sure that, because the AYC members that we have networked with even after the July board meeting, where some of the AYC leaders joined and advocated for the AYC constituency and the work that we are doing. We met some of the partners in the other convenings where they really expressed their work on SRHR, MNCH, and adolescent well-being. So we want to connect with other constituencies to see how we can amplify these efforts. So we are looking forward to that, because a lot of this has come from building up from the GFA. So we want to make sure the work and the impact that has resulted out of the GFA sustains throughout. So that's all from me. Thank you.
Wonderful, Afsa. Thank you so much. And just the kind of energy that AY constituency is bringing is rather enormous. And it was so wonderful to see the success of the events at UN General Assembly, and the kind of discussions that we were able to have was much appreciated. And thank you once again for all your work on that. Moving very quickly to Charlotte, who's the co-chair for the private sector constituency. Charlotte, welcome. And thank you for joining as well.
Thank you so much, Rajat. Good morning, everyone. Yes, so the private sector constituency is going through some really interesting developments. It's almost like we're starting from afresh, and I think that there are some really good opportunities. First of all, we're working on board a number of new co-chairs. So it's my great pleasure to welcome Dr. Poonam Dordana, who is the CEO of Kudi Research and Development from Pakistan. Some of you might have had the opportunity to experience her yesterday during the Ready, Set, Implement dialogue, where she did a brilliant job. And we also have an under 30 vice chair, Dwani Nagpal, that I know very well because she is also very involved in the Global Alliance for Women's Health with the World Economic Forum. What we are doing right now is that we are engaging in a very careful listening exercise. So in the coming months, we will be engaging with all of the other constituencies. We're starting with the NGO constituency to hear and explore how we can better activate the private sector to deliver impact for our shared agendas. Building off of that, we are also planning to organize a series of roundtables where we will be building and developing a kind of a new set of partnership model where the private sector is finding its clear purpose and value-adding role in the broader ecosystem of maternal, newborn, child and adolescent health. And we're really keen to explore how the private sector can deliver that kind of impact, not just as philanthropy, but from an R&D and development perspective, from solutions, capabilities, financing, co-creation opportunities. The private sector has a lot of resources that they can offer to this agenda, and we need to figure out how to activate the private sector in a meaningful way. And we're also hoping that we, through that exercise, can actually open the playing field and bring more private sector members on board. So these roundtables will also be an opportunity for us to really expand. And Marlene, I very much agree with your point about COF. I mean, we also really want to ensure that we can bring that diversity and
I think somebody's microphone.
Yeah.
Please go ahead.
So also exploring how we can really deliver impact on the ground where the needs are biggest. And so we really look forward to that, and we look forward to our engagements with all the constituencies. And we're hoping also that you will be very open and transparent with us in terms of what are the rules of engagement with the private sector. I feel that for many good reasons, of course, there's been some sensitivities and some reluctance in terms of bringing the private sector in as an equal partner. And I think that we need to go beyond those concerns, but then we also need to know how. so that maybe PMNCH can be driving that kind of, this is the partnership model that we want to pursue, and we can offer that platform for engaging the private sector in a trusting way that, where everyone can feel comfortable that there are no hidden agendas and that we can partner in a meaningful way. So that's our agenda, and we're looking very much forward to it. And we also believe that the timing is absolutely perfect with the PMNCH resolution and so many other priorities. From our perspective, we are also right now very involved with the World Economic Forum in planning what we call an activator program that will be looking at postpartum hemorrhage and how we can build a partnership in a number of countries. And we're hoping also to be able to activate PMNCH into that collaboration, focusing initially on India and Nigeria, but hoping that we can expand on that front as well. Thank you very much.
Thank you. Thank you so much, Charlotte. And indeed, I think it's very exciting to see what you are doing with the Lighthouse Initiative, with the World Economic Forum, and really great for us as a partnership to come in there with you and for your leadership and support on this. But I completely agree with the point that you alluded to in terms of, so what are the rules of engagement here, and how do we look at the role of private sector and build that role of private sector within what we are trying to do, and particularly often in the hardest to reach areas. And I hope we can hear the reflections of others in a moment. But just a last intervention that we have from constituency is for the civil society constituency, which unfortunately we don't have Maria Antonietta with us, but the intervention will be read by my colleague Dina. So Dina, over to you for a quick recap of the intervention from civil society constituency.
Thank you very much, Rajat. Good morning and good afternoon, everyone. So I will be sharing a brief summary on behalf of Maria Antonietta Alcalde, the chair of the NGO constituency. As a vital part of the PMNCH NGO constituency, we have made significant strides in advocating for stronger global health policies and improving reproductive, maternal, newborn, child, and adolescent well-being. Over the past few months, our efforts have focused on ensuring that the voices of civil society organizations remain central to international health dialogues and decision-making processes. Through a combination of targeted advocacy, stakeholder convening, capacity building, and strategic representation, we have not only strengthened our collective impact, but also laid a strong foundation for future collaborations. In this summary, I will highlight key milestones from our advocacy efforts, including impactful meetings and webinars, as well as our role in global health representation. So the first point is around advocacy efforts. So the meeting on the WHO resolution accelerating progress towards reducing maternal, newborn, and child mortality in order to achieve SDG targets 3.1, 3.2. We organized a meeting that brought together key civil society stakeholders to discuss and strengthen advocacy efforts around the WHO resolution. This meeting focused on aligning our NGO constituency's efforts to ensure the resolution addresses key areas in global health with a particular emphasis on reproductive health and well-being. In terms of the webinar on the Summit of the Future, we hosted a webinar focused on the UN Summit of the Future, aimed at understanding how NGOs can engage more effectively. We discussed the summit's key objectives and how civil society organizations can influence the future of global health governance, particularly around sustainable development goals. In terms of convening stakeholders, the UN Civil Society Conference, members of the NGO constituency leadership convened a critical meeting during the United Nations Civil Society Conference held in Nairobi in preparation for the Summit of the Future. This meeting provided a platform for NGOs to share their insights, align their strategies, and discuss potential collaborative efforts. The discussions highlighted key regional challenges as well as opportunities, promoting the idea that grassroots voices were heard in the global dialogue. Lastly, in terms of representation, the statement at the Global Leaders Network launch. Our constituency played an active role in the recent launch of the Global Leaders Network, where we delivered a formal statement. We emphasized the role of NGOs in ensuring the global health policies are reflective of the needs of all communities, particularly the most marginalized. This event was a critical opportunity to position civil society as a key partner in advancing health equity on the global stage. That's all from my side. Back to you, Rajat.
Thanks a lot. Thank you for that, Dina. Colleagues, this was 6 of the 10 constituencies that we have that you've heard from. We don't have the representatives, the co-chairs and chairs of the others at the moment, but they will be sharing updates, which we will share with you virtually after the call as well. And some of them may be joining us in the PM calls, as it were. So really open to you all. A couple of things to open up the conversation with. The first is in terms of the process for some of the reviews that you have heard. The governance review is being overseen by a subcommittee of the board, which has got members which include Chris Carter from United Kingdom, Government of India, represented by Aradhana Patnaik, NGO constituency by Maria Antonietta, and UNA by Anshu Banerjee. And the governance review subcommittee is going to be liaising directly with Kate Gilmore, the expert consultant that you heard from, and will be receiving the findings of the review in November, which they will be then transmitting to the board meeting, which will be taking place on the 4th and 5th of December. The process for the external evaluation is very similar. The subcommittee overseeing the external evaluation is led by our chair, Right Honorable Helen Clark. Included there are also Mike Nobiswo from ART constituency and Kathleen Sherwin from the NGO constituency as well. So just to give you a little bit of a quick time check in terms of how these reviews are going to be undertaken and the process that we are following. After the December board meeting, we'll begin the task of putting together the draft strategy, the monitoring, evaluation, learning framework, which we will be bringing to the board meeting that we are anticipating, which will happen in April of 2025 for further review and approval. Colleagues, this is a unique opportunity. You have not only the leadership of different constituencies present, but also membership of a lot of constituencies online. So over to you for questions, clarifications, ideas about what you heard on how we can strengthen further cross-constituency collaborations. I see a lot of appreciation in the chat for the feedback that we have heard. And Chiara, over to you. Please do start us off.
Thank you, but I will ask that you bear with my voice, but I have to speak. I really want to appreciate the contributions people have given. I want to start at the top with the governance. And with the governance, I think it's critically important that we include Africa and Latin America. We have major, major issues. And unless they're part of the core group, it really becomes a problem to get to understand our dynamics. The second one is to speak to S. Boyle, Charlotte, private sector. Private sector, I've been really scrutinizing WHO, and there isn't a standalone private sector guideline. We have integration and some degree of regulation, yet even within the HCPA, we critically recognize with our private sector, we're not going to achieve much. And when I say this, I even want to focus on PPH as one of our major flagships. We're talking about health delivery. We're talking about pharmaceuticals. We're talking about health insurance, diagnostic laboratories, technologies and data analytics, medical equipment, wellness, and even self-care. But we just don't have a guidance document that speaks to two things. And I think it's critical, Rajat, it has to come up. Engagement of private sector and a multi-sector approach into health. We don't have guidelines. And really that framework, if it doesn't exist, it's why it's all over the place. Professional societies have got both public and private sector deliverers of healthcare. So I think that's a critical area we must plug in a hurry if we're to actually make impact and dent the indicators. Yes, you're looking at your strategy going up to 2030, but the question would then be, as another addition from me, what's the so what after 2030? We're already in that conversation of the path for the future. So what are we doing in that direction? I think putting a stop at 2030 may actually make us look in a very confined space. And I want to really broaden that we think even beyond 2030, so that we actually take into account the changing mega direction that the world has to move in, considering the wars and conflict, climate change. We all know what's going on. So I think we really need to look beyond so that we actually get PMNCH as continuously relevant in the current context. Marlene alluded to the issue of advocacy. And I really like the fact that she's also teased out the most important thing is investment into advocacy. We are putting money into research, but research must go concurrently with the group that will help with knowledge translation. And the two groups that are critical here would be, again, the professional bodies and the civil society organization, and together with the academia and researchers. So the knowledge translation, putting it into context, putting into return on investment politically, and putting it even amongst our whole healthcare providers. Not all healthcare providers are cognizant that advocacy is a critical step in actually creating social behavioral change. I will stop there. I know you have to really bear with my voice, but it's critical. I speak because this is what moves me.
Thank you, Anne, and even with the coarse voice, you were very legible and clear in the points that you made, and really appreciate the point that you drove home in terms of the role of the private sector, the need for us to look at a broader framework, but also bringing in the point about need to strengthen investments and particularly at the local level, at the country level, and we are one of the things that we are looking at doing is how we can foster some of these dialogues to help us identify critical outcomes that can be supported and that can be leveraged for us to work further on these issues, both within the local context, but also in the global policy dialogues. Let me quickly turn to Poonam, Simola, and Marlene. And then maybe I can come to you, Kate and Priya, for any reflections you may have from the reviews perspective, in case you want to come in. And then we will have an opportunity to hear further details of some of the portfolios that you have been talking about, CAPS, GLN, parliamentary work from the Secretariat as well. And we'll have further opportunity for a discussion then. Poonam, over to you.
Thank you very much. I'll quickly respond to what just a comment was made regarding the private sector guidelines. In my opinion, and I firmly believe that while private sector is working in public health or MNCH, the best is to collaborate and coordinate with the local government, the state government, the provincial chapters, because that is the only way you can bring sustainability in your programs, and you are working in collaboration with government, so you avoid duplication of efforts and develop complementarities and synergies as well. So this is my understanding for the guideline for the private sector working in any country. Thank you very much.
Thank you. Thanks a lot, Poonam. Much appreciate. Siamola, over to you, please.
Yeah. Thank you so much. Of course, a wonderful conversation, and it's good to hear the sentiments from different leaders. But one of the things that I wanted to reiterate is that there's a meaningful consensus statement which I've been implementing, and of course, is a bit of promoting inclusivity and engagement of young people. But I think over time, getting the discussion and of course what we've been engaging based on research that we've been putting into place, the Live in the Balance Summit and other accountability workshops that have been happening, including now moving to the future. I believe it is timely that we need now to unpack the meaningful consensus statement that we also contribute to bringing issue related to private sector. And I think, of course, aspect of food system and, of course, the rest. We have some other learning moments that have been worked on by Global Alliance for Improving Nutrition, but other organizations. But again, of trying to figure out and see how do we make that consensus statement include aspect on nutrition and other, because if you're able to check it, then it is much focused on one specific area. And of course, when you're talking about adolescents' well-being, then we should be a bit, of course, framework in a way. And of course, understanding that there's a lot of discussion heading to private sector, then it's good to know that we have a lot of, when talking about now the growing population, the 8 billion population, then there's a lot of youth who are now moving to business, whereby we're advocating. In Africa, we're talking about 75% who are heading to that. In Kenya, we're talking about 75%, and majorly in most of the African countries. And then it's critical that we are able to figure out and highlight what this framework, inclusive framework, that is going to inform youth in agribusiness, youth in the business sector. And it's good to embark on other organizations. We have been leading on SBN and the rest. We were able to learn from that. And then the last point is a bit of humanitarian. Checking the world wars in different countries and other crises happening in different regions. Then it's good now that we refine our funding structure and try to reallocate some funding also to youth-led and youth-serving organizations that we need to, just borrowing from what we did in the PMNCH asks when we did during the COVID-19 ask. It's good to revive such a kind of funding and see how we embark on that. So maybe back to you. Thank you.
Thank you, Siamola. Much appreciated the feedback as well. Marlene, over to you.
Thanks, Rajat. I really like these town hall conversations because they can lead to more efficiency and different ways of collaborating. And I was thinking, listening to Kihara's comments, when there is evidence for policies, for guidelines, for whatever, I think they have to be implemented in a country by the healthcare workers, by, of course, government and everyone. But we don't need a separate one for the private healthcare workers and for the public healthcare workers. So this is maybe not even how can these two constituencies work together, but how can it become one constituency? That's just thinking. And the same with what I already alluded to. We have knowledge and evidence that is based on evidence. And we try to see where evidence is missing, where the knowledge and evidence constituency can come in. But ART is doing the same, more or less. So there could be kind of a thinking on how can the constituencies collaborate better, but also how can we maybe reduce a number of constituencies and put them together, because they are the same people often who are in both constituencies. There is a lot of overlap. So that could also contribute to efficiency, I think. Thanks.
Thanks a lot, Marlene. That's indeed the intent also for us to have these forums so that we can start to identify some of these intersections. Quick reflections from you, Charlotte.
Thank you so much. Yes, I just wanted to say I'm taking notes, and I think that with the great conversation that we're having here, this is really informing and shaping our work plan. And I think it's a brilliant idea. I can't see any, I don't know what, institution that would be better at creating such a framework and set of guidelines, as we're talked about as PMNCH, being truly multi-sectoral. So I think that that's a great piece of input that we will be including in our work plan.
Thanks a lot, Charlotte. Kate, any reflections hearing what you heard about the constituencies, the way we work and how we are organized from a governance perspective before I turn to Priya?
Thank you very much, Rajat. Colleagues, it's been a privilege to listen to the exchange. I thought you might be interested to know that many of the issues you've raised concerning aspirations to really strengthen PMNCH are coming through in the governance review. Let me just highlight 3 or 4 just to verify how on point or how relevant the conversation is from the review standpoint. First and foremost, this challenge to get better at clarifying opportunities for and expectations to of partners. What is the partnership journey and what is the mutuality of that? Secondly, is how better to use the constituencies, which may indeed be far too numerous to actually foster the collaboration many of you spoke of. And people have highlighted the importance of thinking more cross-constituency and shaping work processes and accountabilities for greater collaboration. The third key resonance here, I think, is the power of the country advocacy platforms and how important and exciting is the potential there to foster impact in and for countries through those advocacy processes. And once more, sounds a bit odd to talk about that from a governance standpoint, but it really raises critical questions about where PMNCH substantive accountabilities lie. Fourthly, the strong resonance is the point of rules of engagement. And that was a fantastic exchange to listen to. And I think broadly there is strength in the governance system tackling more cleanly and directly rules of engagement in such a strong multi-sectorial organisation. But the final point, Raja, just to say and to really assure people in a way that it's coming through so strongly is that this is a time indeed for business unusual. It's a time for governance unusual. I think already the fantastic leadership that the adolescent and youth constituency is showing reminds us that there are other ways to do business. And it's not just about change for change's sake, but as somebody said, it's about the challenge of being continually relevant. And for governance of PMNCH to be continually relevant to vision and mission, it may just well have to be much more adaptive, much more flexible, and much more nimble. Thank you very much indeed.
Thank you. Thank you very much, Kate, and much appreciate all the work that you are putting into making us move into that direction. Thank you. Priya, over to you, please.
It's a little premature for me to share any big takeaways from the evaluation. I want to appreciate listening to the constituency's reflection. I think that was really important because we haven't actually met with the constituencies. We haven't yet conducted that group discussion. I think what might just be important, because Kate was very eloquent in sharing her reflections, which I may not have for this section of what I've heard, but just broadly, I think what's really coming out in the process of engaging with the stakeholders in this evaluation is the complexity. You know, it's like a rich, textured landscape of advocacy from global to national across so many constituencies and partners. So one reflection is, how accurately does the theory of change really capture this cross-constituency conversation, connects? People have referred to frameworks and tactics. I think there is a lot that is happening in a very fluid way within constituencies, within working groups, but perhaps it's not very easy to capture and demonstrate how effectively that works in the larger system. So that's one of the reflections I have, is that often theories of change become very like instrumental and linear and box like, while here you really have a big microorganism that is working very fluidly. And I feel like these conversations itself are really important to ladder up and build the theory of change from, is really to say what are people actually talking about and what are the kind of needs and concerns they have. So that's one reflection, that's that the theory of change and the results framework perhaps is at a very different level than where the work is. The second is, I think the challenge still is in bringing that local to the global and global to the local. You have some effective platforms, and people mention CAPS and I think digital advocacy hubs. I think maybe we'll hear more about that later today. But I think there are some effective platforms that are the optimization of those may be very different across different kinds of stakeholders. So I think that's the other thing, is how do you socialize the real value of these instruments and platforms that exist for the work that people are talking about doing, because there are facilitators, but perhaps they're not being used effectively. And I think the third thing is, somebody talked about knowledge translation. What we've also been hearing a little bit is that the knowledge products are very good and the synthesis are very good, but the translation of that in the context and people's actual work for different constituencies, what it means and how do we use that in different kind of political context, that is very differential. So I think again, maybe the next level of thinking would be, what are the knowledge translation needs that are really important, and how do you again build the knowledge products from what the actual needs are of the different constituents. I think some of these were also reflected in what people spoke about today. The other area which is of a great interest to us within the evaluation is the fact that really moving from commitments to accountability, and how do you really work on accountability at the country level. And I think the role of the constituencies and the cross-constituency dialogue is very important if we're really going to shift from making commitments to making accountability towards the commitments. So I think there also probably at least what we're learning right now is perhaps the work is very differential and more thinking needs to be done around the mechanisms for accountability, because that can't happen at a very high level. It has to happen much more in a grounded way, and role of partners become very important. And likewise, like people talked about, what is the role of the private sector? Do we have a framework for private sector engagement? I think there's a larger conversation writ large for partners, because there are a huge diversity of partners, some that are very engaged and some that might be less so. So what might be the rules of engagement even for partners? I mean, that's also a question that is coming up in the evaluation. And these are all areas which are more exciting areas to unpack and work with in a very forward-looking way. And I wouldn't necessarily think of them as challenges or stumbling blocks, but like giving PMNCH and all of you an opportunity to really unpack and say, how do we create more and imbue more meaning and texture in this so that we can work more effectively? So I think that's highlights so far, Rajat. I wasn't very well prepared, so apologize for that.
Thank you, Priya. That's very helpful. Actually, to just hear you, from your perspective, how you perceive of some of these conversations and and I think how we might be able to be, as somebody said, continuously relevant as we move into our collective future together. Colleagues, we are into the final 45 minutes or so of our time together this morning. And in the next few minutes, you will hear a set of updates around a lot of programmatic work that you have heard us talk about and the different constituency leadership talk about. You will be hearing from different colleagues in the Secretariat on issues. The first set of remarks will contain presentation on CAPS, the GLN, and our parliamentary engagement. The second will be an update to you on the work regarding the maternal newborn child health and the WHA resolution, followed by AWB related updates. And then finally, we'll be sharing some updates with you on our work on sexual reproductive health and rights, and some of the communication priorities over the biennium. We'll try and keep it short so that you can have a bit more time towards the end of those presentations to ask any questions, clarifications, but also ideas how we can generate it further. And as I think Naveen, who started us by saying early on, I think one of the things that the partnership Secretariat is focusing a lot about is also how can we resource these portfolios further so that we can maximize the impact. So with that, I'm handing it over to you, Ilse, for the first set of remarks. Over to you.
Okay, thank you very much. And just to check, I am sharing the slides? Or someone is helping?
I'm sharing the slides and you are up with the Global Leaders Network.
Yeah, exactly. So good morning, good afternoon, everyone. And let me start my intervention by sincerest thanks to our partners who have been a key contributors to leading, supporting, and thinking through how best and in the most useful ways we advance action and results in the countries and for the community. And I'm seeing many here also on this call, Dr. Hester, Dr. Levy, Dr. Marlene, Dr. Zalalam, Esther. So big thanks to you first. So when we are talking about the Global Leaders Network, this is the network, the first and the only Southern-led global health diplomacy initiative chaired by His Excellency President Ramaphosa of South Africa and supported by other heads of the states with an aim to advocate and champion women's, children's and adolescent health at the highest political level. Then from the other side, as you were discussing global and national levels, it is the PMNCH's Country Collaborative Advocacy Plan initiative, which is the country-focused advocacy through aligned efforts led by the coordinating partners, advancing implementation of policies and the commitments. In the next slide. So I don't think we are seeing them or I don't see on a big screen, but maybe others do. So
the slide now up is the collaborative advocacy action plan slide, Ilse. That's the one you wanted to speak to.
Okay, I can start with that one. So on the Collaborative Advocacy Action Plan initiative, there are a lot of exciting developments and the work is well underway in 10 countries. And as you mentioned, these are at the moment in 10 countries in Africa. So on just a few highlights, and here indeed the appreciation to the national partners leading at the country level, is the importance of knowing the commitments governments have made. And in this regard, scoping review of the commitments and where we are in the implementation has been very valuable to the partners, what we are hearing. And this also includes the excellent work from the last year, colleagues mentioned about the adolescent well-being commitments, and seeing how they are being implemented and what advancement have been achieved. This also links to what is happening at the international level of the uptake of the WHA resolution. The second point, which has been very key and linked to the country processes and mechanisms, is the engagement with the governments. So this work coordinated by civil society members has very close links and buy-in from the governments, and also linking to the parliamentary work, which you, Marlene, alluded to, given their functions in the legislation, in the budgetary allocations, and in the oversight functions, and also ensuring that these are feeding into ongoing accountability efforts, so it's not a one-off. Very importantly, also what is happening, and I see Esther on is to see how we further enhance the synergies and leverage them with Every Woman, Every Newborn, Everywhere initiative, GFF, and the others as well. And then very importantly, and it's nice, and we are seeing that in the countries, is the reviving or strengthening the work of the multi-stakeholder platforms. Like in Malawi, for example, it was agreed that the review of the progress on commitments will be done on annual basis. And then the last point, which Priya, you mentioned, we are using the digital advocacy hubs as a platforms to ensure the partners can join at any point in time, and also they have access to all this wealth of information at any point in time. And then the last point here is what we are also doing is the cross-country peer learning. And this has been really nice to see and valuable for different coordinating partners to see and learn from each other. Please. Okay, this is on the parliamentary engagement. Mentioned the PMNCH is also very active in this work. And in addition to what is being done at the country level through the CAP initiative, we are working very closely and grateful for the Interparliamentary Union. And here there have been a number of activities over the couple of last months, capacity strengthening workshops for the parliamentarians, how to do the advocacy for the budget increases, for the legislative impact in Zambia and Malawi. And thanks, Mike, for joining these efforts. Then engaging also and providing these messages through different digital tools. Like this year, the podcasts were put in place to see if that could be helpful for the parliamentarians. And very much looking how these efforts could be sustained. As Anne, you alluded to, all these different crises and needs and competing priorities, how we elevate the women's, children's and adolescent health. Then the other point is around engagement at the IPU assemblies, because 2 times per year these are convened, which brings together the speakers and representatives of parliaments from almost all of the countries. So then this provides an excellent platform to provide more visibility, again, to the most relevant issues, current issues on women's, children's and adolescent health. Like this month, at the last assembly, there was a specific dedicated workshop on SRHR, how the parliamentarians can champion and lead this agenda among the other priorities they are asked to attend to. Importantly, also, it's good to have these resolutions, but how they are really being implemented at the country level. So that's another element my colleague Etienne will be talking later on. And then being nimble. For example, here the PMNCH, when a concern was raised at the last assembly on the upholding the FGM ban in the Gambia, then quickly together with the IPU, there was a joint statement, there was increased advocacy and also facilitating some peer learning with Egypt, which led to the good results and the ban was upheld. And the last slide is on the Global Leaders Network, which is very, very exciting. If we could go to the GLN slide. And here we have some really great news to share from the September UNGA, because hosted by the President Ramaphosa and supported by us, there was this event which many have referred to as extraordinary, because what we saw is additional 6 heads of the state from the African continent joining the GLN efforts, and these including Nigeria, Senegal, Kenya, Liberia, Ethiopia, Sierra Leone, Tanzania, and we really saw this great energy and commitment at the highest political level to accelerate the women's, children's and adolescent health as a cursor for achieving the SDGs. And a lot of emphasis was also on the SRHR, calling out specifically also abortion as a basic right, and also putting the key impact or influence of ensuring that there are enough financing and resources, and therefore the need for the truly multi-sectorial engagement and action. So this has been now a good moment indeed to accelerate on this agenda, and also really acting on the country's needs and the asks. And importantly as well, the work that Global Leaders Network is structured is also looking at specific countries, which are the focus countries, which are the same ones where we are engaged in a CAP initiative. So maybe with that, I will stop here, and huge thanks to all of the partners supporting these initiatives. Over from my side, Richard.
Thank you. Thank you very much, Ilse, and for covering all of that for us. And we've got some great champions of CAPS in this conversation. So I hope when we have gone through the other updates, we can hear from them as well on those points. And I see Hester has already put his comment in the chat. With that, Etienne, over to you for the PMNCH updates.
Thank you very much, Rajat, and greetings, colleagues. It's a real pleasure to be here with you today and to hear the wonderful thoughts on improving cross-constituency collaboration and PMNCH's impact, including at country level. So very much appreciate the insights from you all. It is inspiring for the maternal newborn child health portfolio, and that program of work includes the prevention of stillbirth. And here in this space, we are really honing in on the implementation of the new resolution to fast track progress on targets 2.1 and 3.2, what sometimes we call the unfinished business around reducing maternal newborn child mortality. We know we're not moving fast enough. This is extremely worrisome in certain instances, including the reduction of maternal mortality. Not only have we stalled, but we've reversed in terms of progress in certain regions. So very concerning and a key priority for PMNCH. In terms of the resolution, we played an active role in convening partners to rally support for the resolution. I do want to commend the leadership of Somalia, which really played a key role in gathering support. And the resolution was co-sponsored by 51 member states, so quite impressive. Our role there, Dina alluded to that in the statement on behalf of Maria Antonietta and the CSO, was to convene partners, was to convene constituencies in a network to gather support for the resolution. I would argue that this is quite interesting because we not only did we include CSOs, but we also included HCPAs, donors, private sector, adolescent and youth. So it is an interesting model in terms of supporting cross-constituency efforts on a very important political advocacy opportunity, and how the PMNCH Secretariat can also work and facilitate this process. So what we did there with our partners was to issue a set of key asks for member states to keep strong language in the resolution, including explicit language on SRHR. So we're very pleased to see that it was kept in the final resolution. We organized a briefing for member states, an informal briefing for member states and stakeholders on the content of the resolution, and always with a view of mobilizing member states and leveraging networks to reach out to member states to gather support for that resolution. Now, moving forward, we are really looking at the key issues in the resolution, the main asks in terms of the implementation and what it means for accountability and implementation at country level. So we are mainstreaming this in our different events and campaigns, and also knowledge products. In terms of knowledge, what we put forward for our partners was a set of key advocacy asks for WHA, for UNGA, that were supported with the events, the key events. We also supported the development of high-level comment in the Lancet Global Health, co-signed by the MOH of Somalia and Ethiopia, and a joint brief with AWNA and CSA on this critical action, the critical actions for acceleration for that agenda. This is also part of an advocacy brief series where we are distilling the key messages for each constituency. And so I really appreciate the ongoing reflections around knowledge translation and being fit for purpose. And so what we do in the brief series is have targeted actions per constituency, which are quite interesting to take that forward. We have a new brief coming out on human resources for health in November, and one on financing in December. Those products are linked to high-level political dialogue series. We've had our first one yesterday on services integration. Thank you, Afsa, Poonam, and all colleagues who were there. It was a fantastic event. Our next one is on HRH in November. And then around UHC Day, we will hold another dialogue around financing. So really the approach here is to mainstream the question of the implementation of the resolution in our knowledge, in our advocacy, in our campaign moving forward. A couple of issues that are in the resolution that are important for the advocacy and the accountability of PMNCH are around financing climate change in humanitarian settings. So for financing, we recently supported the launch of the new Lancet Commission on Investing in Health report at the World Health Summit in Berlin. It's called the Global Health 2050. They have an ambitious agenda of reducing premature death before the age of 70 at the 2050 horizon. But in order to do that, I think it's clear in the report that there's a really strong need to focus on maternal newborn child health conditions. So that is an interesting approach where we can use strong knowledge and partnership building to support our advocacy. So our focus around financing is also on innovative financing, intersectoral financing, and making sure that financing also addresses the needs of the most vulnerable populations and communities. Second priority also here in this space is climate change and the tremendous impact that we're seeing on MNCH. So there's really rising evidence and quite high quality evidence around issues like air pollution, heat stress, that is now emerging that is important for advocacy. And so we have our eyes on COP29 in terms of events and campaigns, and that intersection of climate and MNCH. We are thinking of climate change as a topic for another policy dialogue in the first quarter of next year. I mentioned the advocacy brief series. So here, this is an interesting example of contextualization. We are embarking in contextualization of our briefs, including the climate change one, to really drive that agenda of uptake of evidence for advocacy and accountability at national and subnational level. And we're doing a similar approach with our climate financing and MNCH portfolio. Last but not least is the issue of the huge burden of maternal newborn child mortality and morbidity in humanitarian settings. We are very concerned about the evolving geopolitical situation, the tremendous number of conflicts right now in the world. And so this is a priority. And we're looking at also what it means for the continuum of care. So linking SRHR to MNCH to adolescent well-being. For instance, we're targeting the 16 days of activism against gender-based violence and Human Rights Day in December, and looking at the needs in conflict settings and humanitarian settings, and driving our advocacy and communications in that space for that occasion. So that is, in a nutshell, our latest developments in the MNCH portfolio. Thank you. Back to you, Rajat.
Thanks a lot, Etienne. Very helpful. And colleagues will come back and open it up for questions in the next few minutes. With that, Anshu, over to you for adolescent well-being.
Thanks very much. Before I dive into the slides, I want to take a moment to thank all of you for driving this agenda for over the last 5 years. It's been a huge journey. And also last year was seminal for establishing PMNCH as the flag bearer in this space. And it's so heartening to see well-being come up in this conversation time and again, not only in context of adolescents, but in context of women, children's health, more broadly speaking, using the social determinants of health approach. And noting that health cannot be achieved, or optimum health outcomes cannot be achieved in isolation. They have to be supported by health supporting interventions. So as all of you know, last year was huge for us, a big milestone with the Global Forum for Adolescents, bringing together many building blocks for this area, including evidence work, then translating into policy action and the instruments that drive policy action forward. And one of the examples is the adolescent well-being investment case, and this was launched, and my presentation is going to focus on that as an instrument for mobilizing policy and financial commitments. So the global investment case is a labor of love for us, and we have worked on it along with you over the last 2.5, 3 years, and it was launched at the World Health Assembly last year. It's called The Lives in Balance, making the case for women's, children, adolescent health and well-being. And we will put the link to the short document in the chat. And those of you who are interested can look at the longer, bigger document with the modeling exercise. What comes out of this exercise is a huge figure. And that is the cost of inaction over the next 27 years if we don't mobilize political and financial action of investing in adolescent well-being. And that is 4.1 trillion US dollars per annum, or 7.7% of the GDP in the countries in which this study was undertaken. So that's about 80 odd countries in the world. The sum total of this, it's in the fine print at the bottom of the screen, but I don't normally refer to it because it's so huge. The sum total cost of inaction is 110 trillion US dollars in present value terms. So that's a huge amount that we stand to lose as a community, as the world, if we don't take action for investing in adolescents. However, we want to take this work down to the country level for impact. And time and again, this has been brought up. And Marlene, you spoke very eloquently about connecting to the global to the local and vice versa. So the next step for us in terms of the investment case and giving countries ammunition and decision makers ammunition to advocate for ministries of finance for better financing for this population group is to take the investment case to the country level. And we've started with 3 country-specific investment case with huge buy-in from partner governments. And the Indian investment case was launched in July. The pictures are from the launch moment of the Indian investment case, which is now going subnational level with support of UN partners and the government at the country level. In similar spirit, we are in the process of developing investment cases for Colombia and South Africa. And some of the areas that the investment case talks about in these countries is health and various aspects of health. For example, SRHR, nutrition, NCDs, TB, myopia, road traffic injury, mental health, and education. All drivers of well-being, all drivers of good health, and making sure that this most important life stage in the continuum has what it needs to be their best. I'll give you a sense of return of investments at the global level for some of these interventions. For example, if you put in $1 in HPV vaccination for girls, the return is 20.2 US dollars. Tuberculosis gives us a return of 53.6 US dollars. Scaling up health intervention for adolescents gives us a return of approximately 10 US dollars. Mental health is huge, and it has come up in the agenda for action in the new call to action that Hafsha mentioned, and that the return is tremendous. Again, almost 24 US dollars. Child marriage gives us a return of 26 US dollars. So lots of work to be done to make sure that we have enough instruments, we have enough products, knowledge products, and policy, evidence to policy products to arm our colleagues with boots on the ground to advocate for more investment in this population group. Next slide, please, Rajat. And what we have done over the last year and this year is to work with partner governments and to get some policy and financial commitments. Very happy to report back that as of now, we've had 23 country commitments and 2 regional commitments, which span adolescent well-being, but primarily focus on health and SRHR outcomes. And these are financial and policy commitments emerging primarily from Africa. Some of these countries include Ghana, Nigeria, Ethiopia, Liberia, Zambia, Malawi, Lesotho, South Africa, Namibia, Congo, But these are not limited to just the Global South or LMICs. Just to underscore the narrative that there is need for advocacy for adolescent well-being across the world. So you see commitments from Canada, from the United States, and also in addition, you have two regional commitments, for example, the African Union and the European Union. Our work here is not complete. We need to continue to work with all stakeholders on the ground and partners to generate more policy and financial commitment, and to make sure that going forward, adolescents and youth are centered to the post-2030 agenda. And Chiara, you spoke, what next after 2030? We can't stop at 2030. So this is very much the right time to start thinking of what happens post-2030 and where is that direction of travel. We have unfinished business, yes, but also we have to make sure that we are planting the seeds for advocacy on how to shape the agenda post-2030. With that, I do want to hand over to Rajat, but just with a note to say that this has been the adolescent well-being piece is intrinsically linked to MNCH and SRHR. So what Rajat is going to talk to you about is very much taking that conversation from the adolescents and zeroing in into specifics of SRHR as they have implications for this population group and for a wider population group. And once again, a huge thank you and appreciation for all your support and leadership on this work. Thanks, Rajat, and over to you.
Thanks a lot, Anshu. And indeed, moving from a portfolio which has been and will continue to be a flagship in PMNCH's head to an area on which we have not been consistent enough, if I may say so myself, an area on which we have had some reflections in the last few years within the present strategic framework, but where we have lacked coherence and consistency. And as some of you would remember, with that in mind, earlier this year, a review was commissioned, which was undertaken by Ann Stars to identify what will be SRHR advocacy roadmap for the partnership look like, and many of you contributed to development of that roadmap. And a few key markers that come out of it. The first is the value add of PMNCH developing a coherent and consistent approach to talking about sexual and reproductive health and rights issues in an integrated manner, as it talks about maternal, newborn, and child health issues and adolescent health and well-being. And as the previous presentations have clearly demonstrated, we really cannot be achieving a meaningful, sustainable reduction of maternal newborn mortality without addressing the drivers of that mortality, which often stem out of issues related to violations of sexual and reproductive health and rights. And the partnership has a lot to offer, both in terms of political capital and access, the broad and diverse membership, which is represented on this call, but also to bring a credible voice, a voice that is speaking from the experience of lived realities of partners which span in all the regions of the world and cut in over 120 plus countries, but also increasingly something that the partnership has been associated with is its convening power, not just policy dialogues, these large mega events that we organize, such as the Accountability Breakfast, or the convenings such as the Global Forum of Adolescence, but also the soft power that the partnership can bring in terms of brokering conversations around issues which are often considered difficult and polemic, whether it is comprehensive sexuality education, access to contraception, or safe abortion services. So what can we do both at the capital level in terms of advocating for these issues through initiatives like CAPS and the Global Leaders Network? And Ilse talked about the presentation of His Excellency Cyril Ramaphosa, where he very clearly talked about the burden of unsafe abortion, but also through our country work, through the CAPS initiative, how we can drill into these issues, but also what we can do more in terms of quieter advocacy for countries that are more middle order, where they don't have a full buy-in on the entire spectrum of sexual and reproductive health and rights issues, but are willing to meaningfully engage on some elements of it, and can we use that potential to bring in conversations around the full spectrum of issues. The work that we would want to do and some of the key successes which colleagues have already spoken about. The one example that you heard from the work at the parliamentary level was when earlier this year, there was a legislation that was being presented in Gambia to revoke the ban on FGM in the country. It was pretty much at the spur of the moment that PMNCH, along with IPU, was able to mobilize a statement that was then presented at the IPU assembly. But importantly, what we did after that is what is critical, is that we were able to ensure a cross-learning initiative between Gambia and Egypt, which we facilitated, but then working through the parliamentary networks to make sure that that private members bill in Gambia did not go through. We have been advocating consistently since the revocation of Roe v. Wade by the US Supreme Court, but we need to do more, and we need to bring more of the PMNCH's power to bear as the contestation of sexual and reproductive health and rights issues continue to gain ground in different spaces at the global, regional, and national level. And I'll give you some examples, both within the SRHR context, but also from a wider communication priorities agenda. So some of the upcoming activities that we are working on includes consultations, webinars, and issue-specific briefing through CAPS and other focus areas and platforms that we have established. We are also working on partner mapping to identify new and existing allies through which we can work with, and importantly, where we can start doing some work on coalition building. A big challenge that we are facing within the present context today is the contestation around some of these issues from within the different movements working on MNCH, women's rights, on LGBTQI issues, and what we can do to bring some of these conversations together in a spirit of coalition building. We want to do some public messaging through podcast series on adolescent SRHR involving champions, and some of them are on this call right now, and they may wish to speak about their experiences talking about these issues, but also bringing in an intersectionality of perspective. And then the work that we have been doing in terms of small grants initiative, which we are now trying to make it more dedicated and spotlighting SRHR issues. Colleagues, very briefly, we also wanted to showcase to you some of the ideas we have presently on prioritizing and communication related priorities between now and end of 2025 within the present strategic period. As you know, one of the big recommendations that we got from the board was for us to focus and bring back the focus on accelerating reduction of maternal, newborn, and child mortality. So the impact that we want to be achieving is the meaningful reduction of preventable maternal, newborn, and child mortality and morbidity. And as you heard me speak a little while ago, is also to ensure that we are addressing the drivers through effective communication strategies. Our audiences are diverse. We want to not just focus at global forums in Geneva, New York, Washington, etc. We want to move this focus to the regional level where there is a lot of energy around these issues, but also through the CAP initiatives at the country level as well. And the mix of tactics that we will be looking at, partnering with existing initiatives such as EBINI and others to advocate for global attention for MNCH, but also engaging regional and sub-regional bodies to achieve these goals. So we've captured some of these ideas in terms of our goals and key activities that we will be undertaking. We want to have a sustained focus and keep on building on that over a period of time, rather than to have just a few flashlight events that are on the horizon, but making sure that by the time we are coming to the World Health Assembly in 2026 to report back on the progress made, that the partnership has been able to mobilize its network to achieve the kind of changes that we want to see on the ground. And the same is what we would want to do at the regional level as well. We are working very closely, both with the present administration, for instance, in WHO Afro, but also starting to already initiate dialogue with the new regional director-elect, Dr. Faustine, on how we will be able to work more closely together and looking at particularly issues in terms of fragile and conflict setting between the Africa Regional Office and the Eastern Mediterranean Regional Office, where we are looking at the largest burden of preventable mortality coming from, but also violations of sexually reproductive health and rights. I will stop at this point, and we've got about 10 minutes remaining for any questions or clarifications that you all may have with regards to what you have heard and how we might be able to take these conversations forward. Over to you. I see some very good feedback already in the chat, so I would encourage you to read through the examples of Ethiopia and other things that have been shared already in that space. Okay, I'm not seeing any hands. And Chiara, please go ahead.
Thank you so much, Rajat, for that information. And the more you spoke, the more I felt we really need to plug together, because the representation of the healthcare providers and professionals, we're actually cross-secting. So rather than trying to duplicate ourselves on the similar agenda, how can we synergize ourselves? I think it is absolutely critical. When you even speak like to the African Forum, we already know how to plug in, through our respective bodies. So I see this as something we should really embrace and work very strongly together to get the message sent across communally.
Thank you. Thank you so much. And Chiara, could not agree more with you on that particular point. And then I think this is where we can see things coalescing together and us to drive forward the kind of impact we would want to achieve. Let me quickly go to you, Hafsa, and then followed up with Charlotte and Paula. Hafsa, over to you. You may be on mute, Hafsa. We're not able to hear you, Hafsa. We will try and come back to you. There might be some connection issues. Charlotte, over to you in that sense.
Thank you so much. And building on Chiara's perspectives, I was wondering when we were going through this great run through, that somehow it could be great if we could also underscore the catalytic impact of PMNCH with initiatives that are also happening outside of our community, but often with some of the members of our constituency. So one reflection, for example, was that we have the UNFPA Reproductive Justice and Business Initiative. How can we help catalyze that? We have the PPH roadmap. How can we help catalyze that? So somehow, PMNCH could lift itself up to be that platform for catalyzing impact. And I think that could be an amazing value add to communicate.
That's very helpful, Charlotte, and very interesting suggestion. How can we act as a platform that can bring some of these catalytic conversations and impact together? Hafsa, are you able to join us now?
Yes, can you hear me?
Oh.
Am I audible?
Yes, you are. Over to you.
So I just want to say that PMNCH has been the flag bearer in the adolescent well-being space and the public health discourse, and is now working internationally on focusing on maternal, child and sexual reproductive health. And over the last 5 years, there's a strong foundation that has been built using an evidence-based approach to policy and for promoting adolescence as a key and the longest stage in life. Because this needs attention if we need to achieve better health and well-being outcomes. But there's a lot to be done to keep the energy going and making sure the work moves forward, especially to drive impact at a country level. So what we are asking from the AYC is that the new strategy focus on the adolescent well-being with its intersection to the other thematic areas as we discussed during and agreed during the board meeting in July. Thank you.
Thanks a lot, Hafsa. Very, very helpful. Paula, over to you.
Hi, everyone. Hi, Rajat. Yeah, just, I mean, I've said it in the chat a little while ago, but just again, a plea that as chair of the International Stillbirth Alliance, that stillbirth is really explicit in everything. It still so often remains, hidden in the MNH agenda. And I think that's been the problem, that it means countries don't pay attention and the world doesn't pay attention to it. So can we please be very explicit in all our impact statements and in the titles of things that we're putting out, just so that can be really coming to the high agenda. It's 1.9 million deaths a year, as we know. Thank you.
Absolutely. Thanks for pointing that out, Paula, and indeed a critical issue which we cannot not identify explicitly. Abdul, over to you, please. You may be on mute, Abdul. Okay, we seem to be having some technological issues here. We cannot hear you, Abdul, and your microphone seems to be on mute. So if you would want, please do put your question or comment in chat and we will try and answer, but if your microphone works.
Yes. Good morning, good afternoon, colleagues. Thanks so much. Thanks so much for Hello?
Yes, we can hear you. Please go ahead.
Yes, we can hear you. Hello, are you getting me now? Is that...
You're breaking out, Abdul. Could you please try again?
Hello, can you get me now?
Yes.
Hello?
Yes, we can hear you. Please go ahead.
Hello?
Go ahead, Abdul.
Okay. Thank you so much. Thanks to all the presenters for that wonderful presentation. And I'm Abdul Kadi Sware, the Director for Children Advocacy Forum. My only concern, based on all of the presentations, okay, am I still, maybe it's network issue. Are you getting me?
Abdul, unfortunately, the line is very poor. Could we request you to please put your comment in the chat so we can address it accordingly?
Okay. Thank you so much.
Thank you, Abdul, and an apologies for the poor connection that is precluding us to hear you properly. Colleagues, we are end to our conversation. As I mentioned, this is the first in the series of initiatives that we at the Secretariat is trying to implement. We will have a same conversation this afternoon to cover people working in other time zones and partners joining us. We will be having that conversation from 3 to 5 p.m. European Standard Time. Colleagues, furthermore, this is an initiative which we don't want to do it as a one-off. The aim is that we have regularly these forums to hear and have these conversations forward, not least as we move into the new strategic period and identifying the new structure and the strategies that will inform our future work, but as a mechanism to connect with each other. If partnership is truly partner-led, we need to be connecting with each other in a more meaningful way on an ongoing basis. We will be trying to convene these forums at least once a quarter so that we have some direct conversations with each other, and also for you to be able to inform the work that the partnership and the Secretariat does, not just within your own constituency context, but cross-constituency basis as well. Thank you for your generosity of time and counsel and advice that you provide us. And thank you also for all the work that you do. Looking forward to continuing the conversation, and thank you for joining us today. Goodbye.